Welcome to Science, Health and Healing, Encyclopedia of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Children's Facial Bruises First Aid. If your child hurts and there is the beginning of a bruise which seems apparently pretty large on the forehead, under the eyes, cheeks, chin, here's what I suggest. Take a cold pack. You can just pull anything from your freezer. Take clean paper towel, if that's not available, tissue paper. Wrap it up, but not very too densely, and apply this cold compress straight on the bruised area. Here's what I would also suggest. Start with a very gentle touch and try to do a rotary motion on it. So there is an acupressure type of direct pressure. And then when the child becomes comfortable with this, acclimatized a little, and you can console the child and the child stops crying, then you can start increasing the pressure and again in a rotary fashion cover the whole area. Why should you consider this? The purpose is that bruises are going to leave behind large black and blue marks, and sometimes, especially under the eyes or just below the forehead, you can have large black eyes which persist for days, sometimes for weeks. All of that is avoidable. What this direct cold compression does is, it number one causes vasoconstriction, tightening up the blood vessels. It reduces the bleeding. More importantly, it disperses the blood which has already accumulated just under the skin. So you're mechanically dispersing this blood and you do not allow a blood clot, a hematoma to form. I have seen sometimes amazing results with this simple thing. Now, if the skin is not punctured, you really don't have to worry about. If you think there could be a deeper injury, it requires the attention of a doctor, well, that's a valid thing. And somebody in the family can call them for the medical help, or you can make an appointment. But this is the first aid. If you wait for the 10 minutes, then there would be a hematoma formation, and it would create a big problem with black eye or black and blue marks which will persist for days. Now I have a separate segment where I talk about what do you do indeed if the skin is broken. Children's Health Code was funded and founded by Talat, my wife, and I for the purpose of providing authentic information for children worldwide. Of course, we try to reach children through education for parents, grandparents, and teachers. Please forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Visit our website, www.kids123.org. There is so much more information on that. And do watch this segment a second time so that you're very comfortable giving the necessary first aid without any unnecessary delay for your child. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you.